Glenaoco Prison near Alloa houses some of Scotland's oldest prisoners. Unlike many other jails across the country, it doesn't take people directly from court. But like most prisons, it has experienced the crippling impact of overcrowding. The Chief Inspector of Prisons highlighted conditions which continue to breach minimum standard for human dignity, as well as concerns around hygiene, food quality and limited access to support services. That led to sit-down protests from prisoners this time last year.
That had a consequent effect on what people were able to do in terms of accessing education, accessing work, accessing health appointments. And here it was particularly the non-offensive protection population who were affected by that. So these are the men who may struggle on main location because of maybe learning disabilities, or they are particularly bullied for reasons, and they really were having a very, very poor end of the stick.
The report does speak highly of the healthcare and provision for older people on offer at Glenaoco, but like anything else, the number of people living here puts a strain on what can and cannot be done. This cell was designed for one person to live in it, but at the moment there's 2 beds in here. At the start of the year there were more than 200 prisoners living like this. They've got that number down to just over 100 at the moment, but clearly they want to get it down even further.
Today I have approximately 10% less prisoners here in Glenaoco than what I did have back then. It means that people are living 2 in a cell that is designed for 1. And when the regime's already restricted because of the overcrowding, that has a significant impact on people's health and well-being.
These are common problems across the prison estate. It's why the Scottish Government hopes to have plans for the early emergency release of up to 1,000 prisoners approved. But there is consensus that a longer-term solution needs to be found. At times, prisoners are receiving end-of-life care in this jail. Some here think other solutions could be found for older and infirm inmates.
So we're housing people who have real mobility problems, we're housing people who have dementia, we have people here who have the complexities of general ageing, and we have them in a high-security prison. These people don't need the same level of security. They're not physically able to be making any real risks. The risk that they present to the general public is significantly less.
The early release of prisoners will be voted on in Parliament tomorrow. Discussions on how to tackle the persistent issue of overcrowding will go on. Lewis Mickey, STV News, HMP Glenaoco.